So my husband and I, coming out of residency, wanted to pick a job in a location where we felt like we could make a difference. Open Door was one of the organizations we looked at, especially in the area that we liked.
I wanted to go to a practice that will allow me to do full spectrum family medicine. Since I've been here, I've been able to have a large amount of pediatric patients, women's health, and also geriatric. We don't have that many specialists here, and so by being a family physician that feels comfortable doing all of these things, I'm able to see whatever patient that walks through our office door.
So this was my favorite of all of the places in Western states that I could go to deliver babies in new family practice. I think that Open Door really embodied the best that a CHC can do. So community health clinic for me was always where I was going to work.
I myself have been at the Open Door since 1999, and during that period of time, we've had considerable growth. So we're probably about, we think, a quarter to maybe a third of primary care happens in our system. We want to be the kind of clinic where we are able to follow through on people's urgent needs and on their flu shots and health maintenance needs, and also effective management of chronic conditions. So we're in the process now of building care teams. And these teams then will be tasked with taking care of the health needs of a population of patients, maybe between 3,000 and 5,000 patients. It's obvious that a single doctor in a single doctor's office can't be replicated enough times to take care of primary care needs. We need an entire team.
I think we have really unique jobs and a really unique center in a community with a clinic system that really supports us as individual physicians and gives us a lot of professional leeway to kind of create the kind of practices that we want.
The other thing is support. Since I've been at Open Door, the clinic has been very, very supportive in all the things that I do and all the things that I want to do.
I think that we wanted an environment where it wasn't very rigid and that we were supported by, members of the organization. I mean, we've known and we've met and we've, had dinner with and the CEO and this, and the director of operations, and it feels like a small organization. It is, but it is large. We have many clinics and we reach a huge population of people.
For those who like continuity, if you've chosen family practice, hopefully you like continuity. For me, it informs my practice. It makes it easier to see my patients. I remember what we talked about 2 years ago. And if they say, wow, I've been really stressed, if I also see their wife and their kids, I kind of know why they're stressed out. There's a housing issue, an income issue, there's something that informs my understanding of that patient. So anyway, I love the relationship with my patients. I think that continuity makes my job easier and easier every year. Because of the structure that surrounds me in Open Door, I feel like I can get done what I need to get done.
The other thing is just the area. Living in Humboldt County, this is where, where the Avenue of the Giants, the Redwood Forest is that. Both my wife and I, we love the outdoor. We love hiking. We love playing ultimate frisbee.
The location is ridiculously beautiful. I mean, it's like we've got the coast and we have the mountains, all within hours of each other. I live a few miles from the beach. It's huge open spaces with very few people, and that feels really good to me.
We all have a checklist in our mind where we want to go. Being a physician, we're working a lot of hours, but also you want to have that well-balanced lifestyle. And so living here, you want to make sure that the place allows you to not only be fulfilled professionally, but also socially. And since living here, we're very close to everything in terms of recreational activities, but also we're close enough that we're able to meet up with our friends and our family members.